Namaskar and welcome to India Science. It is our endeavor to take science to the masses and to raise the bar of the scientific temper of the citizens of India. We bring to you a candid conversation today with the Secretary Biotechnology, Dr. Renu Swarup. Many thanks for joining us today, ma'am. Namaste and welcome to the program.
Thank you very much.
My first question to you would be about your department. As biotechnology is now leading the way forward for all kinds of ways to battle this pandemic, what are your various insights into your department?
Thank you for this, Nidhi. The COVID-19 pandemic has been an unprecedented situation which none of us had ever imagined. And biotechnology has always contributed through its interventions to each of the areas, whether it's healthcare, agriculture, environment. This was a particular instance that we had where the biotechnology interventions had to come forward to look at what were the various solutions we could provide to mitigate this health challenge, whether it is for vaccines, whether it is for therapeutics or diagnostics or other interventions. So, our scientists, our researchers, our startups, our industry have all come together very quickly, collectively in a collaborative manner to respond to this very, very unforeseen situation that we have.
An emergency situation, as we would all call it. We're still living in that and getting used to living in that. On that note, ma'am, I'd like to know from you, you just mentioned consortium of public, private, researchers, academia, all kinds of industrialists coming out. Maybe some grassroots people like farmers and all also who have come up with their own ideas. Would you like to elaborate on this consortium and what kind of research is happening there?
So, when this whole pandemic was declared in January, the Department of Biotechnology took immediate action on that, and it was, I think, very early in February itself that we put together this consortium. We prepared a roadmap, a strategy for what should be our R&D efforts, what should be our translational efforts, what should be the product developmental activities. In fact, when WHO did its first meeting, the DBT action plan as the blueprint was presented in that meeting early in February itself. We then put out a call as well to bring together the various research groups. The DBT and BIRAC, which is our public sector, put out a joint DBT BIRAC call inviting researchers to come together in a collaborative mode to be able to respond. And as I said, these different verticals that we are looking at, we were looking at immediate solutions because for the pandemic we obviously, while it's very important to understand the virus, to do a long term deep science into it, our immediate need was how do we bring in solutions which respond immediately. How do we get quick diagnostic kits which can help us to become self-reliant on our diagnostic testing, which was important. How do we very quickly embark on our roadmap to get vaccines developed, because India is known for its whole vaccine development. It's a challenge to bring in people, but I must say that with the foresight of this government, we had already created a very vibrant platform where industry and academia were already interacting very well. We had the National Biopharma Mission in which we had already brought together the researchers and startups. We have BIRAC with its startup grants. We had industry academia collaborations of our autonomous institute. This platform gave them an opportunity to come together because they had a common goal and a common objective. So, while the challenge is there, but I think we were very, very happy and pleased to see how quickly people came together in a collaborative mode, and you can see yourself the results which are now telling you how well they have collaborated in this.
Absolutely. You just mentioned about everybody coming together collectively and working towards the progressive good of all. I'd like to ask you here, ma'am, about you mentioned vaccine and you mentioned virus. Now, what stage of this virus and what are the kind of mutations that it has gone into, and also what is the kind of research that you are doing as by means of genomes, which is something very recently I read a press report about that. So, could you elaborate on that? the 100K genomes or something?
So, you see, this virus is something which we are still trying to understand. The scientists, the researchers, although we did have SARS earlier, but this is a SARS-CoV-2. So, every virus strain has its own new understanding, which is important, not just from understanding the transmission part of it, understanding the infection part of it, but also in being able to devise treatments for it and devise diagnostics for it, to get the vaccines, because all that development needs an understanding of the virus. So, our scientists have taken on the task of doing the sequencing of the genome of the virus and characterizing the virus. While there are a lot of efforts going on within the country, the Department of Biotechnology's autonomous institutes together took up this task of 1000 genome sequencing. In fact, our minister had taken a review meeting on 28th of April, and through the discussions when he spoke with us, the scientists immediately